Hello and welcome to this presentation. So today we will talk about how not to be concerned about our sales targets. And we will go into details about reimbursement system for acute coronary syndrome. We will talk about first about reimbursement by patient. Second, we'll go into details about capital investment for a cath lab. And third, we will talk about price per procedure for acute coronary syndrome. So let's start now. First point, it's reimbursement per patient. In Romania, there are approximately 12 cath labs across the country. 4 of them they are located in Bucharest here. The others are spread in the countries in the major university centers. In those centers, they receive patients with acute coronary syndromes from a larger area. This means if something happens with one of the patients, they call the ambulance, and the ambulance goes there to the location where the patient is, and then they come to the hospital where they have a cath lab. This is a regional hospital. In average, we calculated like 60 kilometers. This is almost 1 hour driving on a normal road. It's an ambulance, it's maybe quicker. Still, there is a time frame, and it's a difference to be treated on the spot. We talk about a minimum 30-40 minutes delay, or in a certain time of after the event occurred. And the reimbursement system for those patients, because this is what we are talking about on the first point, it's about 1,000. Here it's 1,000 euros. In other cities it's 1,200. So roughly it's 1,000, 1,100 euros per patient. So it's a good amount of money that the Ministry of Health is using, and we believe that we can find a solution to match this reimbursement offer. Now that we talked about the reimbursement and we had reached a conclusion about 1,000 euros per patient, now we move on to the second point, which is capital investment. Capital investment for a cath lab, it's roughly 500,000 euros for one cath lab. More or less, it depends on the size, it depends on the features of the angiograph and so on. The thing is that Ministry of Health does not have money enough, so they cover these 12 centers that we talked in the beginning. So money is not enough to cover all the 42 counties, and that's why we talked that patients are traveling from distance to those centers where the cath lab exists. So capital investment, as mentioned before, is roughly €500,000, and we have this capital, this money, to build a cath lab and collaborate with the Ministry of Health for those situations. Now that we covered this topic of capital investment, and we talked about €500,000 investment for a cath lab, then we can talk now about price per procedure, or so-called DRG. So what is the concept in DRG? It's not about only the products that we are using for treating, for example, the acute coronary syndrome, the stents in this specific case. It's about the whole package offered. It's the amortization of the cath lab, it is the payment of the surgeon and the nurse. Inside this price we talk about all consumables used, also about the rent for the space. And we call this the DRG. So DRG per procedure, it's exactly the amount of money that is consumed to treat that patient. So once we have this DRG and we find that it's under the amount of 1,000 euros, we can have a solution. And we can multiply this solution across the country and to place cat labs in almost all big cities across the country. That would help us to transform ourselves from product provider, only items, to services provider, which is completely different, and it helps us bringing our revenue at the level where we want to. So we talked today about reimbursement per patient for acute coronary syndrome. We talked about capital investment for a cath lab, and also we talked about the DRG, the amount per procedure, per all service. Having that said, please let me know your questions today. So, in the end, let's go and cover all the countries with cath labs solutions, and for sure our revenue will grow. Thank you very much. Goodbye.